And Jim recently just recommended a book to me that I read by Arthur Kleinman called The Soul of Care. And it talked about his learnings as a psychiatrist taking care of his wife, who was dying from dementia. And he came up with this definition that I've been really reflecting on as a core understanding of what care is. And I'll give you an example of how I saw it in clinic. He said, care was witnessing and sharing the lived experience of pain and suffering. Witnessing and sharing the lived experience of pain and suffering. It was interesting to see, it wasn't fixing it, right? It wasn't necessarily that you had all the answers. I mean, you probably may, but you were there with them, with somebody's lived experience. And then I'll match it with an experience at the clinic that I felt was really good care. And I do a half a day at this drop-in, at our drop-in clinic at St. Anthony's. And I would say the first thing is that they can actually get in, right? You can't even start the process, they can't get in. And they need to feel like they'll be able to get something, that they don't have to worry about payment, things like that. So with all the assumptions of that context, and that goes to your comment about systems, you get into the room, most of our, we call them guests, because we think hospitality is sacred, as opposed to patients. And so our guest is sitting there, oftentimes from South America. And we have this new thing where we will do co-visits. So it's not just me. I'll bring along Sister Eva. So Sister Eva volunteers at the clinic. She's from Guatemala. She's short. She chortles all the time. And she follows me around clinic to see the patient. And it's happened at least 3 or 4 times. They will say something like, I can't sleep. I have insomnia. In Spanish, I'm using a translator. And I'll go through all my questions about sleep hygiene, and, are you using a screen and things like that. And they're very polite and answer all my questions. And in my kind of provider hubris, I'm trying to teach the nun how to ask open-ended questions. And, and at the end of it, she doesn't tell me a thing. And so I get to a point where, okay, I guess I'll prescribe you trazodone, because that won't hurt you. and it's inevitably a 45-year-old Latin American woman. And then, but I'm watching the eye contact, and she's not even looking at me, she's kind of looking at Sister Eva. And as soon as I leave, and I go, okay, well, you stay here, I'm gonna go tell the MA to nurse. I come out, I start seeing the next patient. Sister Eva's there for 45 minutes. And this lady has connected with her and told her about her brother who's dying of cancer and how she's been having trouble sleeping, and all this stuff comes out. And then I open the door because I'm in the room again, and they're sitting there praying and hugging. And I walk out, and then Sister Eva trash talks me all the time and says, what did you find out? And I go, well, she's not using screens. And I mean, the lessons from this for me are multitude. Connection and witnessing and sharing, there's a little bit of a mystery there that can't be predicted or measured. Sometimes you've got to bring somebody else in. The Asian guy who's using the translator with the stethoscope around his neck, all the nonverbals are saying, you don't get me. The little Guatemalan nun who's wearing the habit, she gets me. And I don't know how you design or construct that except to acknowledge first that what we're doing has a little bit of mystery to it. It's relational, and it's about engagement. And so for me, like I walk away, that's really good care. If you ask me how to measure it, I have no clue.
Yeah.
So, sorry.
So Jim, you're